Welcome to another installment of Gateway Today. I'm your host, David Cash Vasquez, and Gateway Today is that show that talks about all things Gateway Community Health Center and highlighting important topics like autism, which today's show will be covering as we sit down with different guests to shed light on the important topic of autism. Our first guest is our Chief Medical Officer, Dr. Mery Cortes, who will highlight and share some of her personal experiences with autism and dealing with the illness itself. Then we get a chance to move over to our Behavioral Health Director, Adriana Garcia, who will share what services are available to all patients, including those with autism. And last but not least, we get a chance to talk to Laredo's only Pediatric Neurologist, Dr. Garza, who will highlight some of the important developments and research that are available to patients dealing with autism. We got a lot of show to cover, so sit back and relax. Another installment of Gateway Today starts now. Welcome to Gateway Today. Well, as promised, we have a full-fledged show talking about the very important topic of autism and how it's impacting our communities across South Texas. Our first guest is our very own Chief Medical Officer, Dr. Mery J. Cortes, who shares her personal experience in dealing with autism. Check it out. All right, ladies and gentlemen, we are blessed to have one of our familiar faces on the program here on Gateway Today. And of course, she's our Chief Medical Officer, Dr. Mery Cortes. And Dr. Cortes, thanks again for joining us. I am excited to have you and sit next to you and talk to you because, you know, off camera, we talked about your story a little bit. And I think that's what we want to share today with the audience is that story. It's the story of parents who have children with autism, and you are a mother with a child with autism, and we wanted to get a little bit of that story and that background. Talk to me about the beginning.
Okay.
When you found out that you did have a child with autism, what was life like for you when you found out about that? What were the signs? How did you know something was different?
Yeah, and thank you for having me again. So you start noticing things, right? And that's what we want to take from this conversation, right? Is awareness and to start noticing what's going on with your children, right? So it was our firstborn. And we started noticing some delays on her development. And coming from a physician background, you know that kids should be doing certain things at certain ages. So I started noticing, well, she's not stacking cubes, for example. Okay, let's give her a chance. And then she didn't crawl. That's one of the red flags. She walked right in at 12 months and she stopped talking. She will be a lot of making a lot of noises when she was little, but then she stopped talking. So that's when we got alerted by her symptoms, right? Her signs. So we decided to mention it to our pediatrician and all the evaluation started, right? So we were referred to Driscoll Hospital in Corpus Christi with a developmental pediatrician. And usually they're really cautious about giving you a diagnosis right away of autism. Mm-hmm. It was more like a developmental delay. Let's give it a chance. Bring her back in so many months. So, okay. Of course, it's devastating. It's a tough diagnosis to soak in and to understand. You start worrying about what's going to happen or what is it going to be for her and for us. So we started early child intervention here in Laredo. That's a great resource for all the parents. They evaluated her there and they started giving her therapy for early childhood intervention. And basically it's like they're training you to
how to be a parent with a child with autism.
Yeah, how to be a parent and how to stimulate her. right? Like how to make her come to you and to be interested in the things so you can got their attention and play with them and teach them. And those ladies were great. They're amazing. They love what they do. So they did a great job with us, and they prepare them to, okay, so now she pays attention for 10, 15 minutes on the mat. So now we can do other type of therapies when she's
Such an important conversation happening with Dr. Mery J. Cortes and her personal testimony in dealing with autism. We pick up the second half of this conversation right after this short break, so don't move. More Gateway Today on the way.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Welcome back to Gateway Today. We continue our conversation with Chief Medical Officer Dr. Mery J. Cortes, who shares her personal experience in dealing with autism in her family. Check it out.
And tell me about that time though. Like, how did you personally adjust to life? What kept you strong and involved in knowing that you have now a challenge, unlike most parents? What was that driving force?
well, love, right?
Of course.
You love your
Aside
your
from
kids.
love, right? Yeah.
So it's like you don't have any other option other than keeping going, right? And keeping teaching your kid and trying to find a way to help her, right? One of the most challenging things during the beginning was the lack of sleep. They have really big trouble regulating down to be able to fall asleep. So there were nights with 0 sleep or like only 2 hours to sleep. And we wanted this to get better, of course. So you start reading a lot, of course. The pediatrician is a guidance force, but you start doing your own research and even more for me, right? That I'm coming from science.
Of course.
And my husband too, right? So we were trying to see what else can we do for her to improve. We found out that diet is a big aspect of their behavior. So when they're feeling sick, they cannot tell you that they're feeling pain, abdominal pain or bloated. They have a lot of intolerance to food. So she couldn't drink milk, for example. We had to change the milk. We discontinued all the gluten in her diet, no sugary drinks or processed food. And we started seeing a difference in her behavior. I'm not saying that improved completely, but it was another part of her treatment, right? Trying to help her in that matter. And it's like you just have to keep going and you see the progress in these kids and they're amazing. You're never prepared for, I think, for parenthood and even less for being a parent with a kid with this condition. But you just have to go and help them. And
You have to push.
Yeah.
You have to push forward. And I love that you share that for parents out there that are watching and wondering, or even grandparents or family members, right? That because the numbers tell us 1 in 44 children born now are born with autism. I think a lot of folks out there watching will have questions, and you sharing that experience is super, super important and well received. But you mentioned something right now, and I want to ask you about it, and it's the specialties that come from your daughter. Tell me what are those special things that you can see from her developing as she's growing up?
Well, she's really active, definitely. And she likes to swim. So she basically self-learned how to swim, go down to the bottom of the pool, and she does it on her own, and she can spend hours in the water. They have an attraction to water. So we wanted to teach her how to swim. So we will go with her to the pool every day. Of course, we don't have any skills to teach her on that. And all of a sudden, she started swimming back and forth. Of course, winter time.
This is on her own?
On her own, yes.
Wow.
No floaties. She doesn't accept the floaties. She doesn't accept too many things because of the sensory stimulation. So that's one of her things that she does, right? And she's a really happy girl, so loving. She has made so much progress, right? With the help of the school, community, all those great things that we have available.
The message is clear. Keep on, keep going. Diet, lifestyle changes, but more than ever, be an advocate for your child. Dr. Cortes, I want to just say, we are super grateful for you being brave and sharing your story, and also for giving parents out there and those watching hope, right? That letting them know that things will get better. Things do get better. Things are, there's resources out there for them. So thank you for sharing. You're, I think, a hero to all of us, not just in the medical field, but those parents out there that are going through something similar that you are. So thank you for sharing.
Thank you. My pleasure.
Ladies and gentlemen, she is our Chief Medical Officer, Dr. Mery J. Cortes. If you want to learn more or need assistance or resources for autism, then make sure you head over to gatewaychc.com or call us 956-795-8100. And again, thanks for watching this episode of Gateway Today.
Our thanks to Dr. Mery Cortes for sharing her personal experience in dealing with autism. And if your family is dealing with autism, we'd like to extend those services to you right here within our behavioral health department as we head over with our Director of Behavioral Health, Ms. Adriana Garcia, who highlights those services and treatments available for all of our Gateway patients. Well, welcome back to this installment of Gateway Today. And as we continue speaking about autism and behavioral health, I thought it would be proper to bring in our Director of Behavioral Health Services here at Gateway Community Health Center, Ms. Adriana Garcia. Hello, ma'am. How are you?
Good morning.
Well, welcome to the program. And one of the things I want people to understand is what's going on with behavioral health right now, because behavioral health is really just a growing department that continues to offer a ton of services. But tell me about how we're staffing behavioral health in our behavioral health department. Like, what are you all excited to announce to everybody? What personnel are there? Who are providing the services within the department?
So we're very happy to include as part of our department now. We have a psychiatrist, we have a licensed clinical social worker, we have licensed professional counselors, all providing behavioral health services to our patients, including those patients affected by autism. We provide services to the community, right, including their families as well. We do understand that patients with autism come with a lot of behavior challenges. Some of these may include, self-injurious behaviors, aggression. Some patients may also experience some disruptive behaviors at home. So what we provide with our team of experts is basically drawing from different modalities of treatment to treat our patients in a holistic way. One of the things we do right with psychiatry, we are able to provide medication prescriptions for any type of aggression that maybe some of these patients might be experiencing. For on the therapy side, we include services like cognitive behavioral therapy that can help also with those aggressive, disruptive, self-injurious behaviors, as well as providing coping skills for the families who are also affected, right? We understand that autism not only affects the individual, but as well the families and the caregivers. So providing extending the services to them is vital as well. We also believe in the practice of integrated care. So being able to have a team of, the medical provider alongside a behavioral health consultant in one visit, we believe in how that can very well affect our patients, and being able to provide services all in one visit is intricate also to their success.
Yeah, that's pretty cool that you mentioned that, because I think that's probably one of the great advantages of being a patient here at Gateway is that we call it the one-stop shop, right, for a holistic approach to healthcare. You work across the board with medical and dental and pharmacy and ancillary services, right?
Definitely. All of our providers here, right, are able to refer to our program. Granted, maybe some insurances and things of that sort might require specific things. But once a patient comes to our doors, or our attention is brought that a patient is in need of services from the behavioral health department, we can take it from there and be able to assist patients and their families in navigating the system, right? And in understanding how we can help them, and how we can, even if it's a patient who was seen through dental or a patient who's being seen through the medical department, the behavioral health component can come in at any time.
That's awesome. I love it, because for the patients and the parents and the grandparents and anybody that's looking for like a holistic approach to healthcare, that's where Gateway really comes together and where we really shine in that aspect. But staying on the topic of behavior health, I really wanted to drill down on the services of the behavioral health department and really see who could sort of take advantage of those services. What specific services I know you touched on a few of them, but what are those specific services that you're seeing a lot of out of the department?
So we do, because we have a psychiatrist and we also have therapists. The therapists include both licensed clinical social worker as well as licensed professional counselor. So that brings in, a good different mix and perspective from the different type of clinicians. With our psychiatrists, we obviously try to concentrate the medication management. There's also some psychotherapy or psychoeducation that goes in through those visits as well. But all our providers work together. They work side by side. We have monthly meetings as well with them where they exchange ideas or discuss patients as well. So it's a good mix of clinicians to have to be able to provide our patients and their families with the support they need.
Well, you're doing an exceptional job alongside all our wonderful folks in our behavioral health department. And if you want to find out more about our services for our autistic patients out there, or families dealing with autism, to families looking for counseling services, that's what our behavioral health department is all about and here to assist you with. So head over to gatewaychc.com if you want more information, or as Adriana mentioned, 956-795-8100 is the number you want to call. She's the director of our behavioral health department. Adriana Garcia, thank you for your time, ma'am.
Thank you.
Our thanks to Adriana Garcia, our Director of Behavioral Health Services here at Gateway Community Health Center, for sharing some of the services and treatments available for all of our patients here at Gateway. Well, after the break, we head over to Laredo's only pediatric neurologist, Dr. Daniel Garza, who highlights some of the different research and trending topics within the world of autism. More Gateway Today on the way, so don't move.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Welcome back to Gateway Today. Well, before the break, we said we would head over to Laredo's only pediatric neurologist, Dr. Daniel Garza, who talks about research and trending topics within the world of autism. Check it out. All right, ladies and gentlemen, we are here with Laredo's only pediatric neurologist, Dr. Daniel Garza, who gave us some of his precious time to talk to us a little bit about autism. And Dr. Garza, thank you so much. I know when we were walking into your office, there's just so many folks looking for answers to autism. And I know some of our audience has those same questions that I do for you today. So thanks for your time. Tell me about autism and sort of what's happening in the world of autism right now.
first of all, one of the numbers that kind of stuck out to me the most was that autism is more prevalent in men or boys than it is in girls.
4 times as prevalent. Yes.
4 times
it's 4
more.
to 1. For every girl with autism, there's 4 boys with autism.
And right now, kids are being born. About 1 in 50 kids is being born right now with autism. What is happening?
That's a very good question. And there's the long answer and there's the short answer. The short answer is we do not know. That's in short. We don't have definitive answers. As far as theories, there's many theories. And in reality, sometimes we can identify what's behind what the root cause of the autism was, because autism is really a final common pathways of, we have seen some children with autism as a result or as a sequel of massive brain damage from meningitis, encephalitis, premature birth with internal bleeding, and they look identical to children with autism without those without that past medical history.
Yeah.
So, sometimes we feel that autism, it really has many causes, and it is like the final common pathway of many, many conditions.
And one of the first times I got a chance to talk to Dr. Garza, you've been doing this over 20 years, and you're, with regard, an expert in your field. You once shared a story that you've had folks come from the least fortunate to the most fortunate to the richest folks, come on planes, come to see you, looking for that answer, that cure for autism, and it doesn't discriminate, right? It doesn't.
No. Autism is present in all segments of society. It's present in every continent. And we, the distribution can be variable, but we don't know if that's related to the reporting and the criteria being used to diagnose autism or label autism as such. Some people are very loose and label autism to certain conditions that may or may not be, and other people are, less inclusive. So that might explain why in certain European countries, for instance, they report far less autism than in, say, the United States.
And what's your thought on why autism hits boys more than it does girls?
Again, the short answer is we don't know. The long answer is it's probably related to the fact that we just have one X chromosome, whereas girls have 2 X chromosomes. So they have a backup copy of one of the sex chromosomes, and we know that there are many conditions like Fragile X syndrome, which is one of the leading causes of autism in boys. Fragile X syndrome is due to, as the name implies, the X chromosome is fragile. It breaks, it shatters, it breaks when you're culturing it. And that's how we came out with that label of Fragile X. And in boys, that's one of the leading causes of autism. And the reason is that we inherit our X chromosome from our mothers, the Y chromosome from our fathers, and that's the one copy we have. So if it's a defective copy, we are stuck with that one. We don't have a backup. Whereas girls inherit one X chromosome from their mother, one X chromosome from their father. So if one of them is, and every cell in a woman's body flips a coin when they're born, before they're born. Basically, so one of the X chromosomes can be active. The other one is basically turns itself off in every cell in a woman's body. So they have a backup. And basically, by law of chance, 50% are active, coming from mom, and 50% coming from dad. So that usually is enough to save them from a lot of, we call them X-linked conditions. Not only autism, but muscular dystrophy, and many other forms of mental retardation. So there is an excess of males with mental retardation from number.
And for the patient watching, or for those wondering, maybe does my child have autism, or I have questions about it, what are those treatments that you find are most effective for patients with autism?
Well, the first thing we need to make clear is that autism is not a disease. So there is no cure because the kids are healthy. It's a developmental condition. And because of that, is one of the frustrating aspects is that we don't have an easy answer. Here's the cure for your problem. This is an operation that will take care of it, or this is a medication that will take care of it, or I don't know, some genetic interventions. And now we have gene therapy for many conditions, but unfortunately not for autism yet, although that research is very exciting and it's ongoing. But we don't have a cure for this yet. We have treatments for what we call comorbidities, things that coexist with autism. A very large percentage of these children have a horrible time with sleep, and it's been determined that they do have issues with the release of their own melatonin. So melatonin is a fair, reasonable, first and over-the-counter in this country option to treat the very frequent insomnia that these children experience, or fragmented sleep. They sleep. The problem is that their sleep is very fragmented. And for other comorbidities, some of these kids can be very hyperactive or aggressive, or they engage in self-injurious behavior. I mean, they literally bite themselves or slap themselves. So for those, we have medicine for it. It doesn't cure the problem, it controls the problem, but they're reasonably effective and safe.
Well, Dr. Daniel Garza, he's Laredo's only pediatric neurologist. And Dr. Garza, I thank you for being a champion for the autistic community and for always trying to find that answer, because I see it in you. And when I hear you speak about it, I know you're looking for that answer for your patients. You have a ton of them waiting for you outside as we do this interview. And so thank you for giving us insight into the subject, and thank you for serving all of our patients here at Gateway. Again, if you need more information on Gateway Community Health Center, make sure you head over to gatewaychc.com or call us 956-795-8100 and make that phone call if you have questions about autism. Dr. Daniel Garza, thank you for your time, sir.
My pleasure.
Our thanks to Laredo's only pediatric neurologist, Dr. Daniel Garza. Always a clinic every time we talk to Dr. Garza, who stays on top of the latest research and trends within the world of autism, epilepsy, and ADHD. If you'd like more information about autism treatments, services, Gateway Community Health Center's doors are open to all, whether you have insurance or don't have insurance. So head over to gatewaychc.com right now or call 956-795-8100 to find the best treatments and services for those dealing with autism, epilepsy, or even ADHD. Our services are open to all. We never turn anyone away. If you want to catch a full rewind of this episode or any of our other episodes of Gateway Today, make sure you head over to our YouTube channel, search Gateway Community Health Center, and don't forget to smash that subscribe button. Till next time, we thank you all for watching, and remember, your health is your wealth, so take care of it.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.